network failure. I like it. All right. Thank you, G, and good evening, everyone. Good evening to the class of Eagles, or good morning, or good afternoon, depending on which part of the world you are. It's a great pleasure and honor to be on this platform. My name is Akinkunmi Omoyinmi. Of course, C88 Command Secondary School. After leaving school, I went to the University of Lagos. I studied dentistry, so I had a BS honors in dentistry. And I did my youth service, then I proceeded to start work as a dentist with the state government, Ogun State government. And after that, I did further studies in public health and as well as in business administration and an MBA in business administration. Active practice of dentistry. I work both in both sectors, in the public sector, and I also run a private enterprise. So I have a dual cap.
That's very nice.
Thank you.
Yes, thank you very much for that. And as I said, we'll be talking more about our teeth today. Our teeth. And, you know, so one of the things I'm just going to allow you go straight into is why do we really need to take care of our teeth, even at this age? You know, everybody is busy. There's a lot to do, a lot of pressures. We need to just quickly do what we have to do in the morning and get out. But then somebody is telling me I have to take 2 minutes to brush my teeth, or I need to floss. At night, sometimes everybody is so tired, people just lay on their bed and they're gone. So tell us the importance of some of these things. Why do we need to have a good dental hygiene?
Yeah, thank you, Moji. Oral health is an integral part of general health. It's an important aspect of general health. And indeed, you can't say you are healthy if your oral health is not healthy. The mouth is the gateway to the body, and it does a lot. In fact, the function is numerous: speaking, smiling, you know, talking. So your mouth is as good as important to your general health. And if your mouth is not healthy, it could result in causing complications to the general health. And now that we are, I can say, advancing in age, when we do proper checks and proper checks in general, it helps to mitigate or prevent problems arising. Same thing to your health. If you take proper care, if your hygiene is optimal, then you are likely to be in good health. So it's important that the hygiene is optimal to prevent gum problems, toothache, and oral cancers can do happen that people don't quickly pick up. So it is important to do our daily cleaning. 2 minutes is just about enough, because really, if you have to brush in a systematic way, we say, you know, you have to take it in all quadrants: right side, lower right side, upper right side. You move to the left side, lower left, upper left. You do the frontal surface. You do the surfaces of the teeth as well, the chewing surfaces. You know, it has pits and fissures. It has furrows that food retains. So it is important as well that we brush the surfaces. Then you brush your tongue. So by the time you put all this together and you do it in an effective manner, you see that it's about 2 minutes. But just say 2 minutes. So it doesn't take too long, and we say twice a day. In the morning, probably you're a bit in a hurry, you want to catch up to the office, you want to catch up with your business partner or client. You do it in the morning. At night, if you come back, we believe, you should be a bit more relaxed. You've had your dinner, then you can just, take your time again and clean out the food and all what you've eaten during the day. You've got food particles and somewhere within our teeth. So just clean out and you don't leave that overnight. And it's part of, making your hygiene optimal to that level.
Yeah. So, but why do we need so? Because I for a long time did not know why I had to floss.
Okay.
And I was wondering why I've already used the toothbrush. You understand? But why do people need to floss?
I hear you. Yes. Flossing is good and an important aspect of dentistry or oral hygiene. We have various teeth anatomy, shape, why do we floss? We floss because the way our teeth are shaped and modeled, some of us do have spaces in between our teeth. And when we have spaces, even depending on the food and diet we get hanging between our teeth and somewhere within the gum. And probably you're outside, you're in an office, you're in a social event, you can't say, okay, let me go and brush off these food particles hanging somewhere. So the best and most appropriate thing is just to get a dental floss and just get out the food particles, because if it stays there for a long time, food particles on the gum, we have bacteria in our mouth, it begins to decay and fermentation begins. And when it begins to decay, get the food particle out. That's why it is important to floss as you after eating. If you know you have food particles hanging between your teeth, because you can't do that brushing outside. So flossing is the best option.
Okay.
So that's why we have to floss.
All right. Thank you. Because you know, the last time I saw the dentist, they made it compulsory that you don't just, every night you have to floss.
Yeah.
Yes. And you said, of course, in between also. Thank you for that. Yeah. So, because I'm asking this because someone else will say, my mouth does not smell. Someone may say, my mouth does not smell. Why do I have to do all of this? Is it just because of the mouth smelling, or how does it get to that point where people have mouth odor or bad mouth breath or something?
Yes. What we say is, one, what gives mouth odor? You have to be oral hygiene. What do we mean? Brush twice. Hygiene. Brush twice daily. Floss.
Okay.
To make sure food particles is not staying too long on our teeth surfaces. So you need to get it out early. Then you need to cultivate the habit of visiting a dentist. We recommend, if you don't have any problem, you will feel you don't have any pain or any odor, but visit the dentist once in 6 months. Go in for a routine check. They might just pick up one or two things that can advise you on, and it's an opportunity to do a professional mouth cleaning, what we call scaling and polishing. Is deeper than in regular toothbrush and toothpaste we use every day. You do scaling and polishing, and you get your mouth serviced. It's like having the mouth serviced. So the cleaning is deeper and it improves your hygiene.
But
it's important because
do you get people
the overall health,
you get people do that routine check? Is it a common thing?
Check. Where, in Nigeria or?
Yeah, in Nigeria, do people come in, especially adults, Do they come in? You know, children, it's because they always have some pain in their teeth or something. Mm-hmm.
Yes, yes. Even adults down here in Nigeria, oral habit is not good enough. People wait till when they have pain or symptoms in their mouth before they visit the dentist. But gradually, there's an improvement when we compare the statistics to about 10, 15 years ago. You know, people are now more orally aware and conscious of their hygiene. And once in a while, they pop in, especially for those that have dental insurance and they feel, look, I've spent some money on insurance. I've not had any dental issues. Let me just go in and so people now, yeah, the awareness is a bit better than what it used to be before. So we hope gradually we'll get a more high standard turnout for dental checks.
That's interesting. So, you know, one of the other things I was asking you was, you know, when you talked about the scaling and polishing, you know, coming in to have it different from using the normal toothpaste. This is a controversial thing, and you don't really have to go deep into it if you don't want to. But some talk about using non-fluoride toothpaste because of the effect of fluoride. I mean, the harmful effect of, I believe, of excessive fluoride in the system.
Yeah. Of course. Anything too excessive, everything should be done in moderation. Mm-hmm. Fluoride is a natural occurring mineral. We find it in water, and it's been added to toothpaste and some dental mouthwash. It's present in food, in some of our food, you know, minerals, vitamins, depending on food. Fluoride. Yes, fluoride. The structure they form is part of the mineralization of the teeth. It's part of the mineralization of the teeth. And when you look at the teeth, is the strongest substance in the body. It's stronger than bone. And it's because of the mineral constituents it has. If you say, okay, we all know bone. If you say bone is as hard as something, you can say the teeth is about 95%. So you can see the gap, the teeth is actually stronger than the bone. And it's the mineral content of the bone or of the teeth. So what we tend to do is this mineral, once is wow. Sorry. So fluoride is important, is in what is fluorosis to the teeth. Fluorosis means it makes your teeth brittle, discolored, yellow coloration, and it damages the teeth. That's too much of fluoride. But it's still important to have fluoride. Is embedded in our toothpaste because once you have it, it makes your teeth stronger and is more able to resist cavities, caries, because these cavities you have, they break down the tooth substance. Treatment therapy for children that is called fluoridation, fluoride therapy. Yes, so we try to give it to children because they are a bit more, I mean, their mouth is sweet and they take a lot of sweet and sugary substance. So it helps develop and make their teeth resistant to cavity. So fluoride is important, is in toothpaste. So that's the a bit of disparity we have with this herbal toothpaste. They are good though, but we don't know the amount of content of this mineral naturally occurring that are embedded in them. They have their own place, but the mineral is very important because it helps to remineralize the teeth, make it stronger, and make it more resistant to developing cavities. So fluoride toothpaste is still the best.
So, I mean, most over the counter or normal toothpaste that we buy don't contain excess fluoride, do they?
No, they don't. They are always regulated by the regulative body, maybe the dental profession or those or the standard organization of the country to make sure that they have a certain level that is permitted in the dentifrice, in the toothpaste, in the mouthwash, and in the mouthwash tablet as well. That's regulated.
Okay, thank you for that. Yeah, so I'm just thinking now. I mean, as one advances in age, there are things that begin to happen. Do you understand? Is there any extra care? I mean, I've seen much older people, you know, and how their teeth or how their mouth, everything. Are there things we can begin to put in place now, you know, as we are advancing in age that probably we are not taking note of at this time?
Yes, as one advances in age, the oral and indeed the other body, you know, the degeneration sets in, and mostly what is observed in the oral cavity, you know, a lot of wear and tear, you know, showing masticative function for a long period causes, we notice attrition on your teeth wears down, you know, and for some of us, like showing bone, you know, cracking bone.
Okay, as we age, as we advance in age, you know, as is expected, even to the general body, we try to go through degenerative changes, and we need to be more health conscious. Likewise, to the oral cavity, we expect to see wear and tear, attrition on the surfaces. We expect to see more of gum problems, more of periodontal problems. You know, these issues tend to pop up more with advancing age. So, what is the way out? Is just to be more health conscious, oral health conscious as well. We cultivate the habit of regular dental checks. But usually, what we notice is older people come with sensitivity on their teeth. Usually, as a result of mastication over a long period of time, the teeth surfaces begin to wear down. Sure. And when teeth undergo attrition, you begin to see some sensitive part of the tooth coming up. So when some people drink just cold water or hot tea, you feel this shocking sensation. It's because your teeth has wear down. The first layer is up to stomach, and the second layer is being exposed. So these are the kind of things we see. We see more of gum pain, gum problem, gingivitis, more of periodontal problem, the surrounding tissues of the gum problem, and once in a while, in rare cases, oral cancers. But by and large, we will cultivate the habit of regular dental checkup, when these things can be picked up early enough and nip in the bud. That's just the essence, even for the general health as well. So
the most, yeah, so it's not just a fancy thing, it's something that we should do because, and you know, it can eventually affect the brain, as I heard. I mean, that was what somebody was telling me.
Yes, you know, as I've said, it's a gateway to the system, to the body, to the stomach. The mouth is connected to the head, to the brain. If you have a severe infection in the mouth, you know, it could track down to the nose, and the nose, cavernous sinus. There's a connection to go to the brain. So severe infection, it could go to your throat, that you become unable to breathe, to the chest. It will spread. That's how, infection in the oral cavity can go. And even these communicable diseases that we have, if someone has diabetes, then you are meant to have loose, gum problem, loose teeth, because they both work hand in hand. The complication of sugar, of diabetes in the system, is reflected in the mouth, as well as hypertensive patients. You see the symptoms in the mouth. And sometimes, if you just pop into the dental clinic, the dentist might just be the first person to pick up this silent disease. You might not know you have diabetes, but when we see some things, you see your oral cavity, you see the gum and the odor, they begin to suspect. I might just send the person for a routine check, and lo and behold, they can just see elevated sugar level. In that case, you need to refer to the clinician so that to take care of the diabetes, bring down the sugar level, and then we augment the dental aspect. And you have a very good, same as hypertensive patients. When you walk into the dentist, there are some signs you see in the mouth and you suspect, I'm okay. I've done the test, I'm okay. Go for this test, and lo and behold, they are hypertensive. So is an important part of general health, which we should not neglect, really. And we should not wait till when we have pain or so it's important advancing age.
Okay, so yeah. I have been told many times about removing wisdom teeth for children or for young adults. Is this something that should be done? Is it necessary?
Well, is it necessary? Maybe yes, maybe no. You see, what we say about wisdom tooth, it's called wisdom tooth. Why? Because we expect it to come out to the oral cavity like 17, 18, 19 years old. So it's a bit when the children are a bit mature. So it's wisdom when they are wise, when they begin to be adults. So it's called wisdom tooth. So usually it's the last one to come out of the mouth. The last one. And most often times, there isn't enough space for it to come out in most cases. Okay. So when all the teeth are fully formed, this last one, in trying to come out along its path, there's always an obstruction. So it's impacting against the bone or against the tooth in front.
Okay.
And when it doesn't come out well, it's held further down, then most likely it's going to cause a problem. So if you go for routine checks and you just say, okay, let's take a full X-ray, they can pick up this early that, it's not likely to come out fully. But for some, it does come out fully up and you leave it. But in most cases, a larger percentage tends to be impacted and not come out fully. Then it is just wise that we get it out as quickly as possible. Otherwise, most likely it's going to cause damage to the tooth in front, which is a useful tooth. Mm-hmm. And another thing is that this wisdom tooth is not a useful tooth in the mouth.
Okay.
It's been proven that it doesn't function when you chew, when you put food to the back. It doesn't function because of the obscure position it's standing way back to the back, to the mandible. It doesn't really function, but it causes a lot of problems.
When you say it affects the front teeth, how does it affect? Is it because I have my teeth pulling, this way, so how does it impact the front teeth?
I said affect the front teeth. I said in trying to come out, it can get along its path. So in some cases,
it rests on the teeth in front. In trying to find its way, it tries to tilt, look for a very good way to come out, and it tries to bend, tilting to the teeth in front, and it impacts on that normal standing tooth. And when it does that, it's likely to cause problem for that tooth.
Okay.
And can as well damage it. So when we pick it up early, we quickly advise to get this wisdom tooth out, and saves you problem in the future, and it's always good. So these are the part of the advantage of checks. Things are picked up early, and
yes. Because I noticed that people get to do their tests on time, especially for the children, and they get to use. They know immediately if they need braces or something, but that's not something that it's, well, for me growing up was not a cultural thing for us to get our teeth checked if we need braces or not. Is there a difference now?
Yes, there is a difference. Braces, yes, for some, when the teeth are erupting, we say when they have the mixed teeth or the mix by 5, 6 years old, then children begin to have a mixture of the baby tooth and the adult. So in coming out, ideally, the ideal thing is the baby one should fall off, prior to the adult one coming out. Sometimes this thing just happen that sometimes the milk or the baby tooth refuses to fall off. It stays there, and when it's time for the permanent adult tooth to come out, if it cannot find its path, it just tilts in another way to find its way out. And when it tilts, it begins to disrupt the normal curvature that is expected that the tooth is supposed to have. So you might not pick it up as a parent, but if the doctor sees that, look, the new one is coming and this is still standing, you might just advise, let's get this out of the way early enough so that the one coming can take its rightful position. But a lot of our parents, we are not, this is not our, we're not into the, we not pick it up. Usually they don't pick it up, and it comes out in another position, and you don't have a good set. The child doesn't have a good set of teeth. And in correcting the teeth, in moving it a bit, tilting forward, back, but in trying to align and rearrange, you have to put braces in the mouth to realign and reset so that the child can have an ideal and a good occlusion. Because, as I said, smile is very important. The child social activity. You quickly have to step in and make sure that this mild alignment corrected by wearing braces in the mouth. That's just it.
Yeah, and now they have different types, so it doesn't even have to be the wired ones. And,
yes, we have one that you hardly see in basic line. You hardly see that you have braces. That so, the fiber is so
thin, transparent,
thin and pinkish that it matches the gum, and you don't notice that it's, that's the way the tech is going off now.
That's good. But do we really have orthodontists in Nigeria? Because I'm saying that because I am a, I have this whatever here, and I needed braces.
Okay.
But this wonderful dentist decided to put a crown
on it
instead of giving me braces. So we have and then he did it in such a way that this one is coming this way and the one on top is going this. So, and it's something that I've been trying to work on here.
Okay.
I don't know, it's going to cost me, of course, my arm and my tooth and my feet to do it. But I'm just asking because I'm a victim of that. So Do we really have orthodontists in Nigeria?
Oh, quite many.
Many?
We have yes, quite many. And I have a lot of my colleagues because we count it as you said, it's going to cost you a arm and a leg. It's an aspect that is a bit lucrative because these things are expensive to put together. And likewise, the practitioners to charge along that line because they are not cheap. So it's a lucrative aspect and it's expensive to do. So it's best to try and mitigate this problem before they arise. I don't know why dentists did that, but then it's done.
Because it was not an orthodontist; it was just a dent. You know how we just go to a doctor, whether the doctor is for whether it's orthopedic or is whatever. We just go there as long as it can give you, what you need for a headache or for fever. So I think
ideally, what he or she should have done is to give you a referral once he identifies your problem and the best thing that you really need and should be done, because everyone has his or her own limits. That's what medicine is all about. Once you know your limits, if you know yes, you can't just think of this patient. It's just best to do a referral to someone that is competent enough to take care, and that's all. And,
yeah, I had to ask that question if we had orthodontists, but because by the time I went to another specialist, he told me there were only 5 in Nigeria. At that time.
5?
Maybe at that time. Maybe, yeah.
Yeah. Now we have many. As I've said, we dentists, we see it as a lucrative part. So a lot of the younger ones now is always specialized in orthodontics. Yeah. So we have many orthodontics in Nigeria. We're not short of them. Yeah. Yeah.
That's really great. It still will be cheaper than doing it in the Western world.
I believe so.
Yeah.
I believe so
too. Yeah. So, Dr. Akin, what would you like to say to us, moving forward? What are the things you'd like to leave with us? How do we get ourselves into the routine of the checkup?
Yes. Moving forward, I would like to say come a long way. Unfortunately, some of us are no more, and we are advancing in age, every one of us. So we need to be more cognizant of our health, not just the oral. We need to cultivate the habit of regular dental checks, regular health in general, health checks, vitals, we should just try and checks. As I say, yes, we are very busy. We have a lot of meetings, business things to conclude, but at the same time, if you make all this money and we begin to spend it on our health, there's just set aside and time and resources. You have to set for some that don't have insurance, that they have to pay out of it. Then you have to begin to set aside some money. And like I said, some that organization that probably the company picks up their medicals. And when you leave this organization, then your medical comes back to you. And it's more likely to down because with advancing age, these things tend to come up the more at that age, and which we need,
money for. So by and large, I just want to set up time, set aside some resources financially to look after our health. It's very important, and God in its infinite mercy will keep our time, keep us cool to enjoy it. Yeah, that's the message I have.
Thank you so much. Thank you, doctor. And you know, what I've learned is prevention is better than cure. I mean,
exactly.
That's why we're going to be doing the routine checks, whether we think our mouth is smelling or not. It's not just about the mouth smelling, but our general well-being. As you said, you can detect even if somebody has diabetes or hypertension, even from the routine check, you know.
Yeah.
Yeah, and we can also help our children better, as in how to, you know, make sure that we let them know these things. And as we all want to get very old, everybody wants to be 100 or 90 or something,
Yeah.
but you don't want to be and not be able to still do some things. So
Yes.
that's why we're doing this. Thank you so much for all you have taught us today. I personally appreciate it. And yeah, thank you, everyone. Sorry about all the issues we've had during this recording, but I'm so grateful to Doctor for taking out this time. I mean, it's not easy getting a doctor to take out time from his busy schedule. And you know, this man is working in the public sector and also in his private business. So we thank you so much. Thank you. And keep watching Conversations with Moji. Bye for now.
Bye-bye, everyone. Thank you.